Hi, can
How's
you
it?
hear me? Can
Yeah,
you hear?
can you hear me?
Okay. Yeah, I can hear you.
Perfect, perfect.
Okay.
Make sure. So, how's everything?
I'm good. A little bit busy, but yeah, so far so good. Yeah.
Okay, so before we even just like continue on, like what got you started in this industry? What I mean, you've always had that dream. In the Philippines, you came here. You're like, I'm gonna open up a business, right? And just
Yeah.
right. Okay. So, what are the main goal here is like, so I resent the link. So in the email, you'll see the link to the boot camp. You'll see the link to the COVID
Okay.
marketing webinar that we did. So you'll have that. Um, and once you
So
watch that, you're gonna have many more questions later.
yeah, yeah. Okay. Okay. So I'm seeing the links now because I'm not sure if you were able to send this to me yesterday.
I
Because
did, but you said you didn't receive it, so
yeah, I
and I
received
didn't
it.
hear from you, so I followed up
Yeah.
again, and that's why
Okay.
we're talking right now because
Yeah.
I want to make sure I
Yeah.
followed up with you.
Yeah. So these are the links that you've mentioned before. The links that you're doing. Okay.
Yeah,
Okay.
yeah. The
So,
boot
but okay,
camp
but
is
then again, yeah,
the boot camp is 7.5 hours long, so you know
okay. Is
you don't
that
have to
in
watch it all
case
in one
time?
sitting.
Yeah.
Just take your time with it. There's no limit to it, so you can just keep on watching it.
Okay. Okay. So, what was that again? You have a question a
Yeah,
while
so
ago?
you have your business, you got it started, right? You know you had a life in the
Yeah.
Philippines already, yet you decided to come over here, right?
Yeah. So, what makes me decided to put up a home care business?
Yeah.
Actually, before this has been the plan like years ago, even if we didn't we haven't come over yet to the US to migrate, but this is really what I want
Okay.
before everything. And we've been actually planning to buy a home care business way back like 5 years ago in California, but it
Okay.
didn't materialize. So I'm also a registered nurse, and
Mhm.
with my age, it's already hard for me to do the bedside thing.
Mhm.
So it's I think that's one reason also that I know I can still do it. I am actually still connected right now with a home care agency. So I am a registered nurse. I was actually taking with this baby that yeah, my patient was a baby. So what I like with home care is the flexibility of time, because
Mhm.
I have three children, and I just can't work to the hospitals anymore. So with my case, I want the flexibility of time. So I actually, before I put up my own business, so I really wanted to work with a home care company because it's giving me a flexibility of time.
Mhm. I
It's,
agree.
yeah. So yeah, that's why.
Okay. Yeah,
Yeah.
I completely agree. I mean, like, I'm actually appreciative that we started a business because, like, my mom,
Yeah.
she was able to work in home health. She was able to do management. She was the director of nursing. I was the administrator.
Yeah.
And it was really hard working in the floor when you see, like, especially fellow Filipino nurses who are like 60 years old and they're still working the floor.
I know, right?
It's so hard.
Yeah,
Okay.
I know.
So what can I answer for you? I want to be able to make sure that, this meeting that we have here, I can answer as much questions as possible and be more detailed for you with the marketing.
Yeah, actually, just those marketing strategies
Hmm.
that you might share with us. I was actually watching your videos a while ago while I'm cooking
Okay.
lunch for my children. I am listening to your. I just had a time a while ago to listen to your to few of your videos, and those were really helpful. And yeah, most of those marketing strategies that you can share, because I know this is a different industry. I've been working in a hotel. Actually, our business in the Philippines is a hospitality. We're managing a hotel, but
Oh, really?
it's just a hotel. Yeah, but it's
You
just a
said in
small
Quezon
hotel
City,
for
right?
three
Where in Quezon City?
people.
Because I probably stayed at one of those hotels. But I did a lot of Airbnb when I was there last.
Samar. So
Oh, in
if
Samar?
you if you happen to go there, and we
Okay.
also have good tourist spot in Samar, but not more on beaches. But what good in Samar is the falls if you are into that. So
Mhm.
yeah, So we do that. So, but that was just, we were just doing a hotel or a hospitality industry like for more than like five years, I
Wow.
guess. So it's a different industry, but
Mm-hmm.
at least this one, home care, of course it's a different industry, but it's within the line of my profession,
Mm-hmm.
because I'm a nurse. So I had an experience working in the hospital and skilled nursing facility here in the States, hospital in the Philippines. And I really love, my job as a nurse before. It's just that it's hard to be a nurse in the Philippines when you're in the Philippines because you
I
are
agree.
not paid, well. But here it's okay. But, we were able to come here at my age, and I am not that, and I'm not that young
Mm-hmm.
anymore. And it's hard to do the bedside thing of being a nurse. So that's why I just decided to do the business
Sure.
on my own. So yeah.
Yeah. So, one thing you have an advantage of is you've done business,
Yeah.
right?
Yeah.
It's a lot harder for a nurse to start a home health agency without business mindsets
Yeah. Yeah.
because those are two completely different things.
Yeah.
Now, one thing that I like to do in regards to the business is apply, the nursing
Yeah.
process into
Yeah.
the business. So,
Yeah.
add, buy, assess, diagnose, plan,
Yeah.
implement,
Yeah.
and
Yeah.
evaluate.
Yeah.
So what I would really look at is this. Is number one is that, who do you really want to target is the first thing, right?
Okay.
And so the best way to look at it is like who has the patients for you. Now,
Mhm.
everyone's going to say hospital is your main target because there's a lot of patients available. But I also say this is that hospitals are just a lot of work to get into.
Oh, okay.
That doesn't mean you don't go after them, but you have to be more prepared when you go after them with more details, more
Oh,
data in your hands to help you run your marketing. So I would go after the nursing homes and the physicians.
okay. Yeah.
Those are the two things I would go after is the nursing homes and the physicians. Okay. So the next thing I would look into is you want to create your dream 100, as they may say,
Mm-hmm.
or either dream 100 or the dream 150. Um,
Okay.
but let's just say just the dream 100. The reason why you want to do that is whenever somebody who's a marketer or an owner says they want to start marketing for their company, and they say, I want all the nursing homes and all the doctors.
Yeah.
What happens is you really are going to put yourself in a bind and a problem. Because
Mm-hmm.
in marketing for our industry, it's not about that first visit and get a referral. It's rarely going to happen.
Okay.
It's creating a relationship and relationship building.
Yeah, I know.
So, how do you have a relationship with somebody? You have to be in close proximity with them plenty of times for them to build trust. Know, like, and then trust.
Mm-hmm.
So, once you have your dream 100, let's say, you can imagine you then set up a whole sales process and marketing process. The typical marketing process that we do as a company, and when we suggest a new company getting in, my agencies that I own, we have our follow-up strategy. If I ever told you that right now, you'll be scared, and it'll be like I can't compete against that. And whenever somebody sees that, they do kind of get scared from us in our territories when we explain to it.
Okay.
So the basics that you can do is this, and so we're doing the Dream 100. I'm actually taking you to the end of the process, which is the follow-up. But as we go, we'll explain to it. So the follow-up process goes like this. We do a live visit,
Mm-hmm.
but before the live visit, of course, we do a cold call first.
Yeah.
Because if we can set up an appointment,
Yeah.
it increases the chance of us closing. But if we don't get an appointment, we're still going to come and visit you, right? So the live visit is the first of everything. When we do the live visit, we're just trying to find out who the name of the person is. Can we meet up with them for the first time? If we don't get to meet them, what's the next stage and what we need to do? But every time that we visit somebody with that initial visit, whether we can set up a follow-up appointment or not, we're still going to visit them. So this is how it works. When we visit a place the first day, a cold walk-in, by the end of the day, we make a phone call. We do a follow-up call. We follow up call with them and say, hey, did you, if we didn't speak to them, did you receive the package we sent you? We left behind. When's a good time to meet you? But at the very same time so that's a visit already, a phone call within 24 hours, and then the following day they're going to receive an email from our company.
Okay.
Now that's 3 touches already that we just did in a matter of 24 hours. Most agencies, most marketers are not even going to do that. Now, what we do is every week for 8 weeks straight, they're going to receive an email from us.
Mm-hmm.
And each one of the email breaks down our services on what we can do for the referral source, not for the patients.
Okay.
So,
Yeah.
so that's just emails. But every week, we're going to actually visit them still.
Yeah.
Okay?
Yeah.
So if you start looking at that, every time you visit somebody, we will call you afterwards and we'll email you as well. So the way you look at it, every week, a visit, a follow-up phone call, an email, and then a 4th email that comes in naturally. So 4 times 8 weeks, that
Mm-hmm.
is 32 touches that we did with that person. At any given point, that increases the proximity process. The
Yeah.
whole belief of out of sight, out of mind. If
Yeah.
you visit once, they might not even remember you. How many people have you met one time that you forgot their name already?
I understand that. I
Yeah.
worked as a medical representative during my younger years.
Okay.
Yeah.
Yeah.
Understand
So
that in the Philippines. So yeah.
I actually train a lot of medical reps in the Philippines.
Yeah. Yeah.
Yeah, I
I
have.
was a medical, yeah, from
Yeah, I actually,
2000.
I
So
have a whole separate training program in the Philippines for med reps.
wow, that's great. Yeah. So I know I kind of have an idea with what a sales marketing really does.
Hmm.
So I just want to make, I just want to have a knowledge on how to apply that in this kind of, industry, because
Sure,
I
sure.
think this is different, So how do you do the emailing? So do you send that to the doctor directly? So are you able to get, do I need to get the information of the doctor directly? Because sometimes the secretary will just give the email of the company most of the time. Those are just the, and they don't really give the personal numbers or personal contact details of the doctor that you know
Sure, sure. So, very good question. So my answer to that is this, right? So, um, number one is this, right? For the emails, the way we do our emails is we actually have an email campaigner that
Okay.
automatically sends the email. The moment we enter the
Mhm.
person's email, it already
Yeah.
knows to send them an email every week,
Yeah.
so that's that. But when you go into a facility, just like, when you create that Dream 100, you have to know who you're going. If it's a nursing home, you need to know who you need to speak to. If it's a
Mhm.
physician's office, you need to know who you're going to speak to. So in a nursing office, who care? I don't really care about the administrator. I don't care about the director of nursing. I don't care about the ADON or any nurses in the floor. They don't bother me. They're worthless to me. And that's just a mindset that I put, right? I'm after the social worker and discharge plan.
Yeah. I know. Yeah.
That's who you want because that's who you're going to target. Now, when you attack a discharge planner or a social worker, let's say they don't give you their email. Like you
Yeah.
said, what if they just give us the company email? So my question is this, right? I said, okay, well, what's your full name? What's your name? So I get their name, right? Do you have a business card? I'll get the business card. Sometimes their email's in the business card if they don't want to give it and they forget that it's in their business card. If they still don't want to give the email, I'm going to find the email of the director of nursing or the administrator. And sometimes it's just right in the front by the gatekeeper.
Mhm.
When you grab the email, you're going to see sometimes how the email is structured. It's going to say first initial dot last name at this so and so. When you know that that's how their email set up, you
Yeah.
know that the social
Yeah.
worker's email is just like that.
Yeah. Yeah. I
So
understand.
that's where it's important, you know,
Yeah.
on how you structure your attack.
Mhm.
In a doctor's office, you know how they always say something like, well, it's always the doctor who has to make the order. It's the
Yeah.
doctor's decision to refer
Yeah.
to home health.
Yeah.
right? That is just a complete lie.
Oh,
Why is
okay.
it a lie? Yes, the doctor has to write the order, but when the doctor writes the order, he gives the order to the office manager. He gives it
Mm-hmm.
the order to the nurse. They are the ones that calls the agency up. So in the end, they are who you want to speak to, not the doctor,
Yeah. Okay.
right?
But
So
right now with yeah,
it's
right
really
now what?
knowing that you're going to
Yeah.
target, right?
Yeah.
You
I
know, I'm
know.
going to speak to the office nurse and say, hey, before we get started, what makes the doctor make a decision to work with agencies?
Mm-hmm.
So that's the way to be able to find out. That's the situation. Now, we talked about the beginning on the Dream 100, the process. That's your competition matrix. The next one is the end part, which is your follow up. Let's go on the pretty much the part of qualifying, right? So when I go to a facility, if I go in, what they always say is like, well, okay, tell me about your company,
Yeah.
right?
So
So
yeah.
if I ask that of you, tell me about your company, I never tell them about my company. My
Mm-hmm.
routine is, before I tell you about my company, what are 3 things that made you choose to work with other agencies in the past?
Yeah. What if they
That's the
ask me like, yeah, what if they answer me like, hey, you're here to talk about your company, not to ask us questions. Sometimes there are people that,
yeah.
answer.
I agree. There's gonna be people that's gonna say that,
Yeah.
and I'll say my answer to that is this, and I've had
Yeah.
that. I'm like, the reason I'm asking that question is I want to be able to see if it's a good fit for our companies to be able to help each other,
Okay.
right?
Yeah.
So what happens is you have to address the objections. Objections come up all the time. You
Mhm.
must know how to handle the objections. So if I answer it in that level, if I say, okay, tell me about your company, okay, tell me what are 3 things that made you choose to work with agents in the past, that's what we call the buying criteria. What's going to make them choose? What did other agencies do that made them choose? They may say something like, well, when I started working here, they were using that agency already.
Yeah.
Well, that's good. That's good news for me, because then you don't really have an attachment to this agency.
Yeah.
They're going to say something like, oh, they're really good at answering phone calls. Perfectly fine. They have a nice team. That's easy to beat,
Mm-hmm.
right? I'm looking at what are they really looking for. Now, if they answer those, you have to be able to, one thing I like to do is I write it down in front of them. It makes them
Mm-hmm.
see that I'm paying attention, but I'm still looking at them straight in the eyes, but
Mm-hmm.
I'm writing it down to show that my interest, which is good for me. Okay, great. Thank you so much for sharing that with me. Now, if there are things that they can improve on to provide better care for your patients, but take care of you, what would those be? Now, the reason why we ask that question is it's the same question as asking, what is wrong with the agencies you're working with? But I don't want to be negative.
Yeah.
I don't want them to have a mindset of like, oh, because if they think about what are they doing wrong, then they're going to say, well, I'm doing something wrong because I chose those agencies. So I'm giving them a way to get away from the system of feeling bad.
Yeah.
So if I ask those 3 questions, right? Those 2 questions, but the second one, like I said, what can they do to improve, to provide better care for your patients and take care of you? What now the answer that they're going to give me is the problems they're facing with those agencies,
Mm-hmm.
right? So
Yeah.
right there alone, you have 6 potential answers that is going to solve your problems. Now, understanding sales and understanding people is that there's 2 things that makes people move or make a decision. Number 1 is pleasure, and number 2 is pain, right?
Mm-hmm.
So the first question you ask, what made them choose? That's pleasure. The second question is what can they improve on? Is the pain. Pain will make people move better.
Mm-hmm.
So when it comes to your presentation, you're not going to talk about your company. You're going to talk about what your company can do to provide them pleasure and to avoid pain.
Okay.
So if they say something like the pain is, I think the company needs to be able to, they're a little bit slow on providing service to a patient right away. Then you can talk about something like, well, we actually have a policy called our 24-hour admission policy, or where we admit the patients within 24 hours upon discharge.
Okay.
You know, what can you do that is going to make you stand out is the thing, right? So, you know, for our agencies, we have what we call at your door service. So
Mm-hmm.
we tell the agencies that we work with, the referral source, say, when a patient gets discharged, if you let us know 24-hour in advance that a patient's being discharged, we will actually meet the patient at their door.
Okay.
So, you know, right there alone, that's what we call, you know, a pitch, right? That's our elevator pitch. How do we stand out from other agencies? We can say that we'll meet you at the door.
Mm-hmm.
And,
Yeah.
you know, no other agency that I know can promise that. But see, we don't say that a nurse will be there at the door. We just say that one of our employees will be there. So we'll actually send a CNA, if the nurse is not available, we'll send a CNA to meet, or even the marketer will meet them at the door to make sure that the arrival of the patient goes well.
Okay.
It's the words that we use, is that we meet the patient at their door because we want to make sure that the patient doesn't have any problems when they get home. Why do we do that? You know, so I'm just giving you my company, okay? The reason for
Yeah.
that is sometimes the DME does not deliver the oxygen on, you know, right away. So
Mm-hmm.
our client specialist will have oxygen ready just in case the DME doesn't deliver.
Mm-hmm.
That's
Okay.
one of the biggest problems faced by a lot of agencies is the oxygen, because you know the family member is visiting the patient at the facility, and they're trying to get them discharged, right?
Yeah.
And then when the DME comes to the house, they try to deliver it. Nobody's there,
Yeah.
so they have to come back later on. So imagine a patient gets home and there's no
Yeah.
oxygen available.
Yeah.
That's bad.
Okay.
So I'll paint that picture with the referral source, with the social worker, and they're gonna be like, that makes sense. Like
Yeah.
so we already have, we have O2 concentrators in our cars already.
Okay.
So like an O2 concentrator, you can get a used one for like $300.
Okay.
So just in case it just gets used until the DME comes in. So those are little techniques to be able to make you stand out. But those two
Okay.
questions, what made you choose to work with agencies in the past? What are things they can improve on? Is what's going to make you stand out? Because remember I talked about there's the 8 emails that you send them
Yeah.
for those 8 weeks. The
Yeah.
first 3 emails that get sent is all about the pain problems that they're facing. You're going to send them something in the email talking about how you guys are efficient at admitting a patient. You're going to send one about communication, because those are the biggest complaints by referral sources: communication,
Mm-hmm.
payments, what type of payments you accept, you
Yeah.
know, great nurses, great care, those kind of things. So when you have those answers already and those get sent in the email, that right there increases your chance of you standing out.
Yeah.
So because the thing though is, when you give them your information the first visit, they forget all that.
Yeah.
They
Okay.
really
Yeah.
do. No, nobody remembers everything you do.
So how do you do that? Like for example, this tomorrow we have a scheduled
Mhm.
meeting with a family doctor clinic. So how do we do it? Like just do it like presentation formal with a laptop, or just like a conversation, and we just how do we start that kind of conversation? So we're bringing snacks. It's actually a snacks meeting.
Sure.
Yeah, so how do we approach it, like initially? How do we, because this is actually our first visit.
Approach it
Yeah.
as I want to know more about you. You know, approach
Mm,
it as, how would I best say it? Here you go. How about this? Approach it as a first date.
okay.
When you go on, it's been a while since you've been on a date, right? So, but when you
Yeah.
went on that date the first time, you wanted to make sure that the person that you were with wants to know about you. You want
Mm-hmm.
to know that is the person interested about you, right? And
Mm-hmm.
how do you know if a person's interested about you? They ask questions,
Okay.
right? So
Yeah.
in the psychology of people like to always talk about themselves. That's the biggest problem. And recognizing that is when you ask questions, they will give you answers.
Mm-hmm.
So, when we walk in, when we walk in and we have the meeting with them, and we will say something like, hey doctor, you know, once again, it's a conversation before we get started with this presentation, right? Because they're expecting a presentation, right? Let's say you sit down, you have your snacks, hey doctor, before we even get started with this presentation, I just want to know, if you don't mind sharing me, what made you choose to work with agencies in the past?
Okay.
So you're asking questions. Perfect, doctor. The second question, if there are three things they can improve on. So now you can start talking. So if they say something they need to provide, better communication. Hey, doctor, I know, like you said earlier, communication is important for you. I value communication as well. What specifically about communication would you want to know that I can take care of for you?
Mm-hmm.
Because, and then when I ask that question, see what goes on is, on anything, to really get a person's mind open, I hate this because this is actually, you're Filipino, I'm Filipino. In the Philippines, this gets overused a lot, right? And if I say the words to you, you're gonna know what I'm talking about. Are you open-minded?
Yeah.
You already know what I'm talking about, right?
Yeah.
The whole
Yeah.
MLM, the whole pyramid scheme, whatever, right?
Yeah.
So the thing with
I
that
know.
is, to open somebody's mind, really in sales, is to ask a question. If I say a statement, it's not gonna enter their mind. If I ask a question, it actually opens their mind for you to give them some information. So
Mm-hmm.
I'll ask questions. Hey, doctor, you talked about it's important for communication. That's the thing. When they say communication, it's so vague. I want to know more. Tell me about
Yeah.
that communication. And they're going to say something like, well, when I call them at 5 o'clock, nobody's there.
Mm-hmm.
Or they say something like, they say they're 24-hour, but nobody's there at nighttime. The patient complained to me because they tried calling the agency at 8 o'clock at night and nobody was answering.
Okay. Yeah.
Right? So if I ask that question, I know. So I'm going to say, well, doctor, here's a sheet of paper. So when you go in tomorrow, have a separate paper that has your detailed information on how to communicate with you. Meaning, these are the numbers of the administrator. This is the number of the DON. This is the number of the office. This is a cell phone that you can send a text message to. This is an email. This is our 24-hour on-call number. So we'll explain that to the doctor. Hey, doctor, these are ways to contact us no matter what. But at the same time, doctor, you call this number, no matter what, somebody will answer for you.
Mm-hmm.
So, because our goal is to be able to provide communication with you and your patients as well. You see what I'm saying?
Okay.
Now,
Yeah.
I can
Yeah.
take it to the next level for you, right? Because this is what my agency does. We
Yeah.
actually have somebody in place who will answer the call 24/7. And if somebody
Mm-hmm.
wants, they can do video chat live with one of our agents 24/7.
Oh, wow. That's great.
Hey,
Yeah.
doctor, listen, if you want to speak to one of us, via video chat, we have that available. Somebody's
Okay.
available 24/7 for video chat. So
Okay.
once again, we do take care of the communication part, but my agencies take it to the next level of saying we
Mm-hmm.
have this 24-hour video chat availability for a
Mm-hmm.
live person to answer the call. Now that's something, if later on you could put in place, good for you. But I'll
Mm-hmm.
be honest, we, our one agency, for example, in Chicago, we do about 300 patients a month. We maybe get one video chat every 2 months. It's not all the
Okay.
time, but it's
Yeah.
available and it makes us stand out.
Yeah.
You
Okay.
know?
Yeah.
So those are the things to handle. Ask the questions. If they give you an answer, find out more. What you're doing there is you're discovering the deeper decision pain points, the deeper decision choices that they're making. And
Mm-hmm.
that's why you ask those questions. And then you put your presentation there. Because if you start telling about, we offer skilled nursing, physical
Yeah.
therapy, occupational therapy, they should know those services already are available for home health,
Yeah.
right? They should. The question is, that's why I'm saying put that aside and find out about them.
Okay.
If you find out about their decision making, their process, you know, part of the presentation, like, hey, doctor, I know you write the order for the patients. I know that when there's an order needed, you will write, send to home health for eval and treat, so and
Yeah.
so. Once you write the order, doctor, who handles in the facility, in your office, to call an agency for that you assign to the patient? When you ask that question, you find out the person who's in
Yeah.
charge.
Mm-hmm.
So the moment the doctor goes, oh, it's Maria over there. You say, hey, Maria, just wanted to make sure. So now I know, Maria. I'll say something. I'm like, Maria, now I know you're the person that I need to speak to. So so then I'll look at doctor. Hey, doctor, is it okay after this conversation? I'll talk to Maria a little bit one-on-one to be able to know what else I can do for her. He'll probably say, yeah, sure, go ahead. So Maria can't do anything anymore because the doctor just said yes. What you're doing there is you're
Okay.
putting her in the spot.
Yeah. Okay. Yeah.
And so that's the thing. So now you're finding out everything that's going on, because it's not about your company. It's not about your services right now. It's what you can do
Okay.
for them. And I'll ask a question. I'm like, typically, in this industry, one of the biggest problems faced by patients is that they're not taking their medication properly and on time. And that's why they end up in the hospital, just like, the CHF patients. I'll say something like that. I'm sure that this is something that a lot of your patients face, right? They have to say yes because it's the truth.
Mm-hmm. Yeah.
And you could say something like, well, that's one thing that we really pay attention. Our nurses will really pay attention to their medication, pay attention that they're taking their medications correctly. So I don't know what your policy and procedures are, right, for your agency. For our agency, all our patients, we actually make sure that the nurses will set up their meds 30 days at a time.
Mm-hmm.
So
Okay.
instead of just having them, take off the bottle, we have a 30-day pill container that we used to do. But as of last year, we switched to pill packs. So I don't know if you know what the company Pill Pack is.
No.
Pill Pack sets the patient's medication automatically where it's already dated and timed, and it just goes in order. So it goes AM, PM, depending whatever their orders are, so that when the nurse comes in, we can see that if they missed certain medications.
Oh, okay. So I
So
have to be contracted with that company, like if we want to use that.
yeah, it's just like, how you get contracted with other pharmacies, you can contact those
Yeah.
pharmacies as well. That's just a choice. But,
Okay.
at first, so you're not adding more stuff to your worries and how you should handle things. Just talk about how you set up your medications 30 days in advance, so you know if they're taking their medications or not.
Okay.
And then so you can address any patient teachings, any family education, those kind of things, right? And so like us, for example, we have our medication reminder program where we tell the doctors, actually, we call the patient 9 o'clock in the morning at 5 o'clock in the afternoon, exactly the same time,
Yeah.
to remind them to take their medications,
Yeah.
right?
How much is that service? I've been hearing that from your videos. The med.
For us, it goes up to $10 per patient a month. So
Okay.
they're package deals. There's companies
Oh.
out there that does it also per patient, like $20 a patient. But we do it by package deals. So if you go to medicationreminderprogram.com, that's like, there's 3 different packages in there. So
Mm-hmm.
if you go to
Okay.
medicationreminderprogram.com, on the top part it says agencies. You click into
Mm-hmm.
that so that you get the agency pricing instead
Oh,
of the individual pricing. So,
yeah.
like right now we have about private users that just uses our service, not part of an agency. We have over 1,200 patients now that are using the service a month.
Yeah.
And for agencies wise, we have close to about 12,000 patients that are using it on a monthly basis.
Wow. That's
Mhm.
that's great.
Yeah.
Okay.
So it's just that, having that
Yeah.
service offered to
Yeah.
them, and
Yeah.
and not to be not to do a humble brag, but I'll tell the
Yeah.
physician, I go, hey doctor, do you know any other agencies that can guarantee you that they're calling the patients every day to take their medications?
Yeah.
You
Okay.
know,
Oh.
this is just
Yeah.
something that we're willing to spend extra out of our pockets for the
Okay.
patients because we
Yeah.
want to provide better services,
Yeah.
right?
Okay.
So right
That's good.
there alone, the doctor has, they're like, what?
Yeah.
What are you talking about? Actually, can you give me a second?
Yeah,
Just keep.
sure. It's okay. It's okay.
No,
Okay.
because I actually want to show you another thing. So I think it's going to be
Okay.
helpful for you too.
Yeah. Okay.
Okay, I'm back. All right. So um, this is a sample, right? This just arrived in my mail because it got returned. So
Yeah.
so this one right here is a medical button,
Uh-huh. What is
right?
that? Medical what?
It's a medical
But
button, right? So
okay.
all our home health patients, home care and home health patients receive this when they get admitted.
Okay.
So we share that with the physician. We say, hey doc, just let you know, all our patients gets this. Now there's going to be some patients going to say no, but a lot of patients says yes, especially their family members. So I'll give you a quick example. I'm just gonna go ahead and press the button, right?
Okay.
So what this does is that it's there's a third party vendor in the back of stuff that uses this. So hold on, it's a little bit slow today. But what happens is if a patient, let's say for example, has an emergency, they can have this thing right here.
Failed. Please try again.
Let's do it again. Actually, I'm not too sure if this is connected. So I just want to make, because this got sent to me by one stuff. So that's what's wrong with it. That's why it got sent to me. So what this does
Mm-hmm.
is if a patient has an emergency, they press the emergency button and it contacts a third party. And somebody,
Okay.
somebody will direct them to either 911 or call the person in charge of the patient. And we're always in charge of that. This costs like $29 a month. The machine costs $50, $29 a month, but it's an added thing for the patient.
Okay.
Yeah, I think that's what's wrong with it. There's something wrong with it. That's why. Okay. So, but because I just want to be able to.
Please try again.
Yep. So something's wrong with it then.
Okay. So if the
But
patient press that, there's a
yeah. So
third party
if it's
call
actually connected, it'll
Mm-hmm.
go to that, right? So
Okay.
so that's the whole thing with it. So we'll show a
Yeah.
physician this, and once again, it costs us $30 a month for a patient. It's additional
Okay.
cost for us, but once again, it's
Okay.
something that makes us stand out from another physician. I mean, from another agency,
Agency.
right?
Yeah.
So that's the thing right there. So what's nice about this particular this higher end one, if a patient falls, it knows the patient fell
Oh, okay.
because it has a change in its height. So it's pretty much like a mini cell phone almost. So
Okay.
the main purpose for these things really is just what makes you stand out. Now, at first, you can even say, if a patient requests this, we can offer it to them and there's no additional cost. Just to see if they're gonna, if the physician likes this and will jump in. Because if the patient doesn't want it, why give it, right? If they're not
Yeah.
gonna use it, why not? Why give it? So,
Yeah.
but it's just, once again, it's just another thing that makes you stand out.
Okay.
You have to do things that makes you stand out. So like I said, that's a part of your process when you're doing the sales stuff, when you're meeting with them. Ask questions. Don't present. Hey,
Okay.
what's this? What's that? Because the truth is
Yeah.
this: when people are eating, they're not paying attention much.
I know. I know. Yeah.
So just ask the questions. Because sometimes there's people that walk in for a lunch and learn just to get the food and walk out and not really
I
pay
know. Yeah.
attention. So you wanna kind of grab the attention, you know. Um,
Okay.
you want to bring enough brochures for them. Uh, don't give the brochures the moment you walk in.
Yeah. Okay.
So,
Yeah.
ask those 2 questions first. Ask questions.
Yeah.
The brochures is towards the middle, and
Okay.
the brochures you have a trifold, right? Your brochures.
Yeah.
When
Yes.
you hand a person a brochure, open it for them. Don't just give them the brochure,
Okay. Yeah.
right? Because if you have it open, so let's say I'm going to give it to the doctor, I'll be like, "Hey, doctor, here you go," and it's open. I'm going to open it for them because they have to
Yeah.
close it and
Yeah.
look at it, rather than if I give it closed, they might not open.
Yeah. Yeah.
You see the big difference that goes on with that, right?
Yeah.
So
Okay.
that's the whole presentation part that you really have to, jump
Yeah.
into. So watch this, right?
Yeah.
What are the 2 questions you need to ask?
What are the good things that the current agency is, giving them, or what are, yeah,
Okay,
the
so
pleasure and the pain. That's what I
yeah,
remember.
so
Yeah.
so don't say
So,
what are the good things, because
okay.
you're now going to help them associate good with the current agency.
Oh, okay.
So the question is, what are 3 things that made you
What are the
choose to work with
information?
agencies in the past?
Okay.
I'll email
Okay.
that to you, the question, so that
Yeah.
you know.
Is
Um,
yeah, this,
hold on. Let's. I'm gonna do
and
the
then
email right. I'm gonna do the email right now, actually.
yeah. I
So
hope you send that to the right email that that are the trend that we're
the
facing.
FAHBOLASTIG@yahoo.com, right? So I'm
Yeah.
just following
Yeah.
our stuff. So what are the 3 things made you choose to work with
Yeah.
agencies?
So we're actually just um working with our, I think I mentioned that with you the last time we speak, that we're working with our Medicare accreditation. So we're
Mm-hmm.
working with this 10 patients,
Mm-hmm.
hormonal patients that you know, we need to comply with.
Yeah. For better care to your patients, take care of you. Yeah, and so part of the question is also one of the things when you're doing a presentation, and don't forget this because money is another big problem that they have. So I'm not talking about
Yeah.
how you're going to pay them, but how are patients going to pay for services. So what you're going to do with just these few physicians, you're going to say, hey, and just to let you guys know, a lot of home health agencies, all they prefer to get is Medicare patients. What's
Mhm.
amazing, guys, is we accept all Medicaid, Medicare, and private
Yeah.
insurances. So we're your one-stop shop. Now, later on, once you get approved, you're going to say, we only accept Medicare. They might get mad at you. That's perfectly
Yeah.
fine. You lose them, and they stop using you, but you already got your agency started. Right now, your goal is just to get
Yeah.
those 10 patients.
Yeah. So we don't say that we do that for pro bono and for Medicare accreditation.
No,
We don't do that.
no.
And what if they ask me like, hey, okay, so are you accredited with all of these accreditation bodies, which is what we are doing right now yet? And
Okay,
so if
perfect.
they ask us
Most
that
of them won't
information,
answer that question,
yeah,
but here's the thing. You're approved by California, right?
yeah, no, Colorado,
I'm sorry, Colorado.
yeah,
You're approved by
oh
Colorado. So
yeah,
you can say, yeah, we're approved by the state of Colorado to as a home health agency in the state,
okay,
right?
yeah, so
If you
yeah,
say that we're approved by Colorado in to provide home health services in the state, they're not going to say anything else anymore. They won't really ask for accreditation. They're not going to ask if you're CHAPS. They're not going to ask if you're JACO. They're not going to ask if you're ACHC. It doesn't
they're
matter.
not gonna ask if we are Medicare accredited, as long as I say that okay, we accept any kind of payments, any
Exactly.
insurance. Okay,
Yeah, so
okay,
that's the thing right there is like they're not gonna bother. It's funny how like in the Philippines it's completely different. They want to know, are you accredited? They want to know. I mean, they even want to know what's your what's your ranking. They want to know what's your grade. They want to know what's your what school
yeah,
you went to. Did you go to
okay,
Suleiman? Did you go to here? Did you go there? All that stuff.
yeah,
It doesn't matter here. Are you approved to
okay,
do business? Sure. That's all that
yeah.
they need to know.
Okay. Yeah. All
Right?
right. Oh, wow. Yeah. good thing. I had a lot of, tips from you.
Yeah, so that's
Yeah,
just get those 10 patients,
I
and then
know.
later on. What now? I have a question though. What made you choose ACHC? Is that what 21st Century told you to use?
Yeah, yeah.
Okay.
Because they're not good.
No, 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 no. They're federally approved, right? So they're good. It's just that's a I look I'm a I used to
There's an advantage of, getting CHAPS or JAGO over ACHC.
they all have the same process. Everybody's different. I just I prefer Chaps over Jayco. Um,
Oh, okay.
that's just my stuff.
Yeah.
But I've dealt with ACHC before. They're okay as well. It's just
Yeah.
I just don't like their logo. I'll be honest. I don't like their logo. I don't like
Oh,
that
okay.
green. It's just that green. At least
Yeah.
Jayco is gold. Chaps is orangey yellow. ACHC is
Oh, yeah.
boring green. So if you put that in your, you know how when you put that in your business card later on, green just
Yeah.
doesn't look good in any business card. So
Oh,
that
really?
I guess maybe that's
Actually,
more of my thing.
yeah. Actually, the reason why I got them is because we get discount because of
Good.
us,
And the
getting.
truth is, it doesn't really matter. And the truth is, you don't need to put their logo anyways, right? You just
Uh-huh.
you
Yeah.
have to post your certification when
Yeah.
on your in your office. When the doctors
Yeah.
do come in. I mean, when if a state comes in, they want to see that stuff. So that's perfectly fine. Put that in your you can put that in your website as well. So but the main thing
Do
is
you
just that
do like, yeah? Do you have like policies and procedures manuals like for home health for pediatric patients, something like that? Do you sell that in
not
your
for I
company?
don't have it for pediatric. That I
Okay.
don't have. I think Briggs has that if I'm correct. You know, for us,
Actually,
we just
century, yeah, 21st century they have it, but as I've mentioned before, I'm having problem with them.
yeah,
Yeah, I
just
don't I don't want to add on to the services that they're actually providing. I just want to finish with my accreditation and all that, and then I'm done with them.
yeah,
Yeah.
just get
If I'm
yourself
gonna get
approved.
any services, I'm gonna get it from another company. I don't want to
Just
work
get
with.
yourself approved. Look into Briggs. Briggs
Yeah.
has a lot, a
Yeah.
plethora of different types of policies and procedures.
I
So
think they have the certified nursing home care consultant. I think, yeah, they have that also.
I believe so. I
Yeah.
mean, I'm not as familiar as my. It's been a while since I've gone to the Briggs site, just because I have my own policies and procedures that I have. So
Okay.
I use that. But pediatric it's a good choice to get to pediatrics.
Yeah, because what's good thing with pediatrics is that the reserve the the retention of patient is
It's
longer.
continuous. It's
Aside, yeah, continuous when when you have one patient, you can serve them for years and years. All you
Mhm.
have to do is recertify and recertify.
And
So
you have less competition. But the
yeah,
thing though is you're going to be dealing with Medicaid.
yeah, Medicaid.
You'll be dealing more with Medicaid. So whoever you're. Do you have a biller already that's going to be doing your stuff?
Not yet. No, not yet. Because almost every biller is asking for Medicare number. So
Yeah.
I wanted to finish the Medicare accreditation first. Because I tried applying with Medicaid, even with their temporary
Mhm.
enrollment, emergency enrollment because of COVID. But still, they would need us to be Medicare accredited.
Yeah.
And then I tried enrolling with this private insurances, the Care Centrics.
Oh,
They also want us to have, Medicare,
I hate
number.
I hate CareCentrics.
Yeah, why? But their fees are very low, though. I don't know.
No, oh no no
Yeah,
no. The fee they sent you they told you right the fees. You can barter with fees with them. You can say, hey, no, this is what we want. So
oh, okay.
yeah, CareCentrics. Gosh, those guys. They tried to pay us $80 for therapy visits, and I started laughing. I laughed at the person. I said, listen, like don't you know? Because some
Yeah.
agencies will say yes to it.
Mm-hmm.
I'm like,
Okay.
no, I mean, I can give you what our
Yeah.
adjustment piece is. And that's what the thing for me is I would rather find the patients than worry about, joining CareCentrics or a place for
Yeah.
mom for them to refer patients to me. That's just not me.
Uh-huh.
So
Yeah.
if I'm marketing correctly, if you're doing what you're supposed to be doing, you're going to get patients coming in.
Yeah.
So
Okay.
that's just the main thing that you have to really work on is how can I get patients for myself without relying on third party
Yeah.
referral sources? You know, can I go
Yeah.
directly
But I
to
think, are there a referral source, the care centrics?
they,
Okay, because
they also will call, they will say, okay, we have a patient in your area. Do you want to take the patient?
okay. Because I thought, because I tried, tried credentialing with this private insurances, and they referred us to us. So I thought they're the one who are, servicing this, different kind of insurances. So
Yeah,
I don't
so
really.
they're the payer, but they also may get patients that they need to find services for.
Oh, okay.
Because that's the biggest problem is that their pay is so low that some
Yeah,
agencies don't accept
yeah,
it. They're like agencies are gonna be
yeah,
like, I'm not even gonna bother dealing with them or patients from them because they're not
yeah.
gonna give me any money, right?
Oh, yeah.
Just think about it, the insurances uses them, so they're like the third party. Then they connect, so it's like they're taking their cut from the insurances.
I know, right? But
Mhm.
how can I go directly to the insurances? Because I tried that and I can't,
Some
go
insurances
direct.
won't let you because they're already closed. They have closed providers. So
Yeah.
what you have to do is you have to be part of an open provider network, or like I said, going through Care Centrics to be able to get
Okay.
patients as well. So you still want to have that, but you cannot rely on a profit margin by just dealing with Care
Yeah.
Centrics. So
Yeah.
you want to be able to, like I said, Medicare patients are the best. They just are.
Okay.
Or if
Okay.
you get a direct referral, so if you're an open provider with like, Blue Cross Blue Shield or Humana, those kind of things, and if you get a referral a patient, you can do a pre-qual, call them up, say, hey, this is a patient qualified for home health services. We get a doctor's order. But with insurances, the problem with insurances, they get to find out first, how many visits are they going to approve, how many therapy, how many nurse visits. So you have to get those amounts and you don't want to overdo it. So the last thing you want to do is, admit a patient with private insurances and then provide service like you would do for a Medicare patient, but then you only get approved for a certain amount. So always get a pre-qual for insurances first before you start providing services.
Yeah. Okay. That makes sense. Yeah.
So that's
All right.
that's that's for that.
And
Are there any other
yeah.
questions that I can answer?
None at this moment already. Yeah. And I have the login from with your website, so I can just go there and then I will shoot you an email if something comes up.
Yeah, just
Yeah.
shoot us an email. Let us know.
Yeah.
What we can answer. You
So
have the boot camp.
CRM, do you have that service, the CRM something software? Do you have that?
I'm sorry.
The CRM software, do you have that?
Which CRM software?
The customer relation
So
management,
yeah,
something
CRM
like that.
software that we use Nutshell. We either use
Oh,
Nutshell is the CRM service that we have. Now, if you're talking about like a software, like there's a like towards the end of the boot camp, the last 30 minutes, um,
okay.
there's a software that we use that we know which nursing homes have the most patients to give. We know which doctors to target because
Ah, yeah.
but those software cost my agencies $10,000 a year.
Oh, okay.
So
Yeah.
it's up to you if you feel that you can afford something like that.
Yeah.
Sometimes for beginning, you may not,
Yeah.
so, I mean, I was able to grow our agencies without those softwares
Okay.
from scratch,
Okay.
but I can tell you that once you've been in business, once you can say I have an extra 10,000 to give a year,
Okay.
I would say then put the money down to that software because your marketing will really
Yeah.
double.
Okay.
If you have a good marketing team and you have that software, but not when
Yeah.
you're first starting off. As
I know, especially
$10,000 is a lot of money to give.
yeah, I know.
You know,
Especially right now, we're not getting any revenue, but we're spending for the office rental, telephone, all the bills.
yeah.
But okay, but we'll get there in
No,
time.
all you need, because you're a mom and pop. type of a business. It's not like you're paying additional fees for an administrator for DONs. Um, all you need is a good 10, 15, about 15 patients average a month, and you'll have a
Okay.
full salary already. You know,
Okay.
you're paid
Yeah.
off already, facilities paid, everybody's paid because you're
Yeah.
doing a lot of the major work. But like later on, once you hit 30 with your type of a business strategy, then you're perfectly fine. But
Okay.
the goal here is to be at least 100 minimum.
Oh, okay.
That's where you want to be. And if you do the marketing correctly, you have your dream
Yeah.
100, you attack them good, you should hit 100 within a year average.
Really? Yeah. In your experience, from the time that you start, like what was the time frame for you to get, to really move forward and you have all of this accreditation? Because I've been hearing some agencies that they took us like 2 years to get really getting patients. Is that how long it
That's
is?
because they didn't strategize on their marketing, right? So
Yeah.
I'll give you a quick example, right? So when we first opened up our agency, it took us like 2 years to get our license and a provider number.
Oh,
And that's just because we unfortunately brought in the wrong consultant.
oh, okay.
Once we brought in the right consultant a year later, she got us approved in less than a year because she did it correct. But getting patients was difficult because we didn't have a process set in place. So my mom was able to grow our business in about 2 years. But the second year was where it really expanded. She brought the company from an average of 50 patients a month in 1 year to the second year to over 200 patients a month. But then after the second year, the two marketers left, started their own home health, and
Oh,
our
okay.
agency went from 200 to 30 patients in less than 3 months.
Oh, wow.
And
Oh,
that's when my parents brought me in to start marketing, and I had no idea to market. So my first 6 months of no idea on how to market was like
uh-huh.
I could bring in maybe 10 patients a month for the first 6 months, for the first 3-4 months. And that's when I started taking real estate classes, car
Yeah.
sales classes, just to learn sales and marketing, kind of, and and then how to apply that in home health. And I started learning the whole process and started looking at like pain and pleasures, learning those things, and then what really applied. And once I knew that I had a system in place, when I had a process in place,
Yeah.
that's when I went from averaging 15 a month to averaging over 100 referrals a month by myself. And
Wow.
so within that 6 month process, I was able to go 0 to 100. But then, so that was that. And then what ended up happening for me was I wanted to do other marketing tactics that
Yeah.
my mom did not want me to do.
Uh-huh.
So because she didn't want me to do, I couldn't do it because I wanted to stop. I wanted to stop giving away lunch and learns. And my parents says, no, give lunch and learns. I said, I want to stop. They said, no.
Okay.
We didn't have a website for a company. They
Uh-huh.
wouldn't. They would not give me. Even though I was making decent money, good money, they wouldn't give me $1,000 to get a website.
Okay.
Right?
Really?
No,
Yeah.
website's not needed. Email, no. We didn't even have an email. I still had an AOL.com email at that time for a company.
Okay.
That's
Yeah.
how bad it was. And so I ended up actually starting my own home health agency.
Mm-hmm.
Right.
Oh, okay.
So the way I started was I bought an agency. Um,
Uh-huh.
and then got the 855A form, transferred it to my office space across from our company in the same building. And
Oh,
and what I did was I got brand new referral sources from that company because I didn't want to do what a lot of Filipino agency does, where they transfer one patient to the other back and forth from agency to agency, and that's completely wrong. You can't do that.
yeah.
And so what I did was I did a whole complete strategy, brought in a marketer, and I grew my agency from 0 to 200 in less
Wow.
than 9 months while still getting 100 patients for my mom.
Oh, wow. That's great. Yeah.
Yeah. So then I could, so the whole purpose of that was was to kind of laugh at my parents and just do a I
Okay.
told you so.
Yeah.
That this is how it's done. And so I said, listen,
Yeah.
I grew from zero to, for here to this stuff,
Yeah.
not going to the same referral sources as we had for the other agency.
Yeah.
So does my strategy works compared to yours?
Yeah.
And so by then they knew I was right. So then we started doing the strategies in both facilities, and
Oh,
so once that was going on, then I was concentrating more on the other business of the family because we had an LPN school. So
oh, that's good.
yeah, we had an LPN
You
school,
have
CNA
nurses from the
school.
Philippines?
I'm sorry?
Do you get nurses from the Philippines? Do you also hire nurses from the Philippines? Like
No,
you don't staffing
we don't do
something.
because that's just too much work.
Yeah. Yeah, I know.
And then you have nurses that all of a sudden jumps the contracts and all these things.
I
They
know.
they don't want to pay you the $10,000 contract, fee and all that. So I'm not even gonna, you know.
An additional headache. Yeah. You
Yeah.
know?
So I'm like, nah. We'll
Yeah.
I have brought in nurses though.
Okay.
I have
Yeah.
brought in nurses, but you know, direct hire. I'll say, we'll sign the paper. You pay everything. I'm not gonna. You pay your.
Yeah.
But your direct hire will get you in here.
There's a lot of my friends from the Philippines are okay. You have a company in the States. Can you hire me? Can you?
Yeah, I just, a lot of the nurses that we hired, we said, listen, you're gonna pay for everything, right? You're gonna
Mm-hmm.
pay for everything. When you get to the States, you're gonna have a job available for you. We'll sign the papers. If you want to
Yeah.
stay with us, stay with us.
Yeah.
If you want to leave,
Yeah.
leave. But at the same time,
As-
at least I didn't spend any money, you know.
Yeah. Yeah.
So
I.
we've done that. We've done that for like about 12 nurses. Uh,
Oh.
Out of those 12 nurses, only one still remains in my company.
Oh wow.
Yeah.
Yeah.
So, but hey, as long as they got here, that's
Healthcare school is just really a school, or is it online and you're certified?
no,
Something.
it's just
Yeah.
so we actually sold the business to Aqua Institute 2 years ago. So we had an LPN program for 7 years. We graduated over 1,000 LPNs.
Wow. Really? Yeah. That was big.
It was good
Yeah.
money. But then we started. The reason why we got rid of it because we started looking at the business, and once we saw that a lot of the hospitals were doing the whole we only hire RNs routine, having the magnet status and stuff like that, we're like, this could be a problem 5-10 years from now. So let's
Okay.
get out of the business. So we sold it, turned profit on it as well. I still have the school to train CNAs and phlebotomy technicians.
Yeah.
So
Okay.
that still does pretty well. Yeah,
Okay.
so it's a good business also. An LPN school in Chicago, an LPN school is harder now because there's too much competition. Like
Ah,
in Chicago, I know 5 Filipino families owning LPN schools.
wow. Really?
Now, if
Yeah.
somebody wants to open up an LPN school like in Colorado, in in Vegas, in Florida, those states are still good to compete against, but not the big states like California or Texas or Chicago or New York or Miami area. You have to understand where you need to open it up. It takes about a year and a half to get approved, um,
Oh.
but it's also good business. Um,
Oh.
I don't believe in online because I know one LPN school that cheated a lot of Filipinos in the Philippines.
Mm,
It
really?
was called Kennedy Global, and
Yeah.
they got a lot of
Yeah.
Filipinos.
Oh,
They took a lot of money from Filipinos there, and so
really?
it was
Yeah.
really sad. It was really sad. So yeah, so
Well.
either or, whatever it is. Just so when you have the meeting tomorrow, like I said, what are the 3 things that maybe
Yeah.
with agents in the past? What are the 3 things that if those agents can improve on to provide better care for you and to provide better
Yeah.
care for your patients and take care of you? What would those be?
Okay.
Ask the questions with these people. That is the main
Okay.
thing. See, when they answer your questions, what ends up happening is you know now what to do for them.
Yeah.
That's the
Okay.
whole thing of this business is once you know what to do for them,
Yeah.
you're gonna win.
Yeah.
Knowledge is power, you know.
Yeah.
That's the main thing. But if
Yeah.
there's any questions that you have, please
Yeah.
send me the questions
Sure.
I'll answer it. Um, you know,
Sure.
I'll send you another message later on. Uh,
Yeah.
I'll get you my direct cell so you can text message me if you want,
Sure.
uh,
Okay.
and just move it from there. So
Yeah.
if there's any,
Hopefully we
yeah,
Yeah, hopefully we get that 10 patients, and yeah, we only need actually just 5 more, and then we're good to go with the
yeah,
survey.
yeah. Just get the
Yeah.
5, turn in the letter, the notice NOI. Turn that in, and by then, you should get your patients and go from there. Go to the physicians, but go after home care companies.
Okay.
Go
Uh-huh.
to home care companies and tell them, hey, this is what we're doing. We
Yeah,
need
you
10
mentioned.
patients. We'll provide nursing care. We'll do this. We'll do that for you guys. And another thing Colorado has is group homes.
Okay.
Those mini assisted living group homes. If you
Okay.
find somebody that'll let you take care of that, you just jump in and take care of the people in their one home. You might get 5 patients in one home.
Really? How do I do that? Just group home? I will just Google that. Group
Yeah,
homes?
yeah. What you do is you look at senior group homes. So they're like under assisted living. Like they're really popular in Florida and popular in California and Arizona, but they're also popular in Colorado. So just look up for group senior homes. And what happens is it's pretty much somebody bought a house. And
Okay.
let's say I bought a house, and it's a
Uh-huh.
5-bedroom home. And then what I do is I have 2 people living in each room. So it's like a mini assisted living facility. So it's like a real
Okay.
estate business because I own the facility, and you
Yeah.
know. So imagine if I'm charging this person 3,000, this person 3,000 a month. It's lesser than paying for an assisted living facility.
Yeah.
So go after those, find out those places, and then you might get your 5 patients in one facility.
Yeah, okay, sure. I'll do that. Thank you for that information. And then I'll call you if I have some questions about, because you mentioned you're not fun with the lunch and learn. So how do we do that? So more, yeah.
So we'll get into that, but just a big
Yeah.
the reason for that is that let's say you spend $100 for a lunch.
All right. Yeah.
My answer to that is, remember I told you we're gonna visit them every week for 8 weeks.
Yeah. Yeah.
So if I'm spending $6,
Yeah.
$7 every time I visit, something good, but doing that for a whole 8 days, I'm still spending the same amount, but
Yeah.
I visited them more.
Okay. Yeah. Okay. So
Okay,
I'll ask more about that next time we talk.
no problem.
Okay.
Okay, thank you out
Thank you
there.
so much for your time.
No
And
problem.
then, yeah, I'll see about your package with that, because I like that medication reminder. So once we get our patient, so I might, yeah, as well,
Yeah,
look
and
into that with that
just
button that you had.
use that for your build up with the physician.
Yeah.
You say you offer that. If he gives you patients, let me know. I'll add them to the
Yeah.
list. I won't charge you. Let's get you
Oh,
getting
okay.
prepared.
Thank you so
So just
much. Okay.
offer it to them and then see what happens.
Yeah. Okay.
Okay?
Okay. I'll mention also about that button. So let's see what happens.
Sure.
Okay.
Okay.
All right. Okay. Thank you
All right.
so much,
No problem.
Michael. Yeah. Have a good one. Yeah.
Okay.
Bye.
Bye-bye.
Bye. Bye. Yeah.